my presentation in the topic of artificial intelligence in healthcare will probably from a different perspective, because this is more related to healthcare. I will start with an overview of artificial intelligence in healthcare, because AI now is transforming the healthcare across different areas in medicine and in healthcare. For example, in diagnostics, in personalized and precision medicine, in drug discovery, in the process of clinical decision support and systems, in the medical research, in the area of natural language processing, in the robotics and patient engagement, and creating a more efficient and patient-centered healthcare systems. We now are witnessing more AI-powered and enabled tools in healthcare for those providers to make them more in power of doing decisions, making informed decisions by analyzing large amounts of data. As Rakesh mentioned, big data in healthcare as well. AI is used to identify the patterns, predicting the outcomes, optimizing the treatment plans for patients, individual patients, which is reflecting more on personalized healthcare. AI is also used to improve patient outcomes and increase the efficiency in healthcare system. In addition to that, it's very essential to address the ethical considerations like data privacy, bias, transparency. All of these are very crucial to ensure that responsible AI implementation is being done and protect patients' rights and prevent any worsening of their existing conditions or disparities in receiving healthcare services, for example. One of the areas is the diagnostics and personalized medicine. AI is assisting in analyzing medical images, for example, like X-rays and CT scans and MRIs, by using these different AI supported and based algorithms, leading to improved early detection and potential health issues with more accurate diagnosis and better informed healthcare decisions. Because AI helps to identify early a type of injury. For example, like the image here, it's just a designed image. It's not a real image. But if you can imagine that we have 60 scans of the MRI for the same patient, it would take the doctor like maybe 15 minutes to figure out which cuts or which scans or which parts are or have the abnormality. But for the AI, it's easy for the system to find the abnormality in 2 or 3 of these cuts. So it can easily identify where is the tumor or where is the cyst within the tissue, within the brain or something, and then suggest even the type of the lesion based on comparative analytics and so on. In addition to that, by analyzing patient data like medical histories, like genetic information and different lifestyle factors, AI can help the physicians to tailor the treatment to individual patients, resulting in a more effective interventions, reduced adverse events and side effects, and more precision and personalized approach to medicine. AI can also identify patients at risk for certain conditions by assessing risk factors and analyzing historical data, which enables early intervention and early treatment, which means better treatment and more effective management of their medical conditions. In the area of drug discovery and medical research, AI actually accelerates drug discovery by analyzing large amounts of data, identifying the potential drug targets, predicting how these drugs might interact with each other and with the body as well, and simulating the potential side effects, allowing for the development of more effective and more targeted treatments. AI also transforms medical research really by enabling researchers to analyze large amounts of data, identifying new patterns and new connections between, for example, risk factors and conditions and their symptoms and signs, treatment effectiveness, and so on. So this also supports the medical research. While automating all of these tasks, such as data entry, analysis with AI, this can really help to speed up the research process, reduce the human errors, and allow researchers to focus more on complex tasks and designed outcomes. In the area of remote monitoring, for example, and also in the area of patient engagement, we find that AI can be used to monitor patient data, such as vital signs, wearable devices, Internet of Things, enabling some medical equipments to communicate directly with hospitals, with healthcare professionals, with server computers and so on, which can help to alert the healthcare system or the providers as well if there is a potential issue, a potential problem, and enable timely intervention. Remote monitoring can also improve patients' quality of life. It can also reduce the number of hospital visits to emergency departments. It can also allow patients to remain in their preferred environment, ultimately reducing the healthcare costs and improving patients' accessibility and equity to receiving high-quality healthcare services. AI also engages patients in their healthcare by empowering them to take a more active role in their healthcare, in their wellness through chatbots, for example. Now we are witnessing development of chatbots and conversational agents in mental health, in GP areas, in primary healthcare, virtual assistants, personalized health information provided to patients, leading them to do better decisions regarding their, for example, self-management of certain conditions, especially chronic conditions, mainly cardiovascular and diabetes, if we will give specific examples. The future of AI in healthcare, actually AI continues to evolve and the healthcare system is likely to transform significantly with much improvement in patient outcomes, more informed decision-making, and increased efficiency across different aspects of healthcare, especially in the diagnostics and treatment. Addressing the ethical considerations and ensuring responsible AI use will be a very essential part for the benefit of patients, and it needs more effort from all the stakeholders, developers of AI, users of AI, as well as regulators and legislative-like organizations. The collaboration between healthcare providers, technology companies, and regulatory bodies is very important for establishing the guidelines and best practices for using AI in innovation in healthcare. And the integration of AI in healthcare will also require continuous education for healthcare professionals as well to support better understanding of these technologies and how they can really be used for the benefit of patients. Now, how can AI impact different types or different aspects of healthcare jobs? AI has the potential to significantly impact employment in healthcare sector, both positively and negatively. This includes, for example, job displacement, because AI and some automation might lead to displacement of certain jobs where these are responsible for repetitive tasks or things that are related to reporting, for example, interpreting medical images or interpreting lab results and so on. This can be completely automated, which will be replacing some part of the job done by certain healthcare professionals. For other jobs, it could lead to some kind of transformation. So AI could also transform the existing healthcare rules, requiring healthcare professionals to adapt to new technologies, new skills. For example, physicians and nurses may need to learn more about working alongside AI-supported tools or driven tools and systems effectively, which means that they might need a new set of skills to manage their new jobs after being transformed by AI. One more impact is the increased efficiency, because AI has the potential to improve efficiency in healthcare by automating the processes This could be considered as a support for healthcare professionals so that they can focus more on direct care, they can focus more on human interactions, and leave the other jobs of reporting or repetitive tasks to the AI systems to do them. This might end with potentially requiring fewer staff in certain areas and enabling existing staff to manage even a larger patient population. On the other hand, it could also create new jobs. So AI could create new job opportunities for healthcare professionals, especially in the area of data science, in the area of ethics, algorithm development, system integration. And all these new rules would require, as I mentioned, specialized sets of skills to be used to support these new jobs. Enhanced decision-making also, this is a kind of impact on the job because AI can really enhance the clinical decision support. They can also, through the algorithms, identify abnormalities, suggest new treatments, suggest diagnosis, and so on. In addition to that, remote monitoring, remote care, telemedicine, also the AI-driven remote monitoring will be a great impact, a significant impact on the concept of telemedicine and remote care for both patients as well as for healthcare professionals. So these are the main impacts of AI on jobs in healthcare. Now, skills required for our students to use or to start using AI in their fields. Well, I agree with Rakesh's presentation about different types of skills. We find that students will need definitely some kind of technical skills like programming, where students should be proficient in programming languages if they aim to work mainly in AI in the healthcare. They will need also mathematics and statistics, mainly understand how to interpret the statistics and how to understand the results and outcomes. They might need technical skills related to machine learning and deep learning. They might also need technical skills related to data processing and analysis, especially the different types of analytics, as described the descriptive analytics, predictive analytics, and prescriptive analytics as well. They also will need soft skills like critical thinking and problem solving. They will need communication skills. They will need collaboration skills where they can work alongside AI with other stakeholders of the healthcare provision itself. In terms of ethical considerations related to AI, they will need to equip themselves with a sound understanding and foundation of ethics. So students should learn more about the ethical considerations related to AI and should understand responsible AI development and implementation. So all of these are skills required for our students. Now, preparing our students for AI integration and opportunities, they have to understand and learn how to incorporate these different AI modules and courses. We need to incorporate these modules and courses into our curriculum. For example, because at the Master of Health Management at the College of Health Sciences, we don't have yet like a component on AI. However, we are using AI as examples in the unit, for example, Unit 5, Health Informatics, when we are giving examples of clinical decision support systems and tools. Predictive analytics, predictive tools, we refer to AI. But when we are developing, I hope we are planning soon to develop a program, a master in health informatics, then AI would be a complete module, a big module within this kind of course. We also need to, for example, support our students by inviting guest speakers to conduct workshops, lectures. Those should be like expert people in the AI, and these should be AI focused events. We could also add more projects with more hands-on projects on analyzing AI impact on healthcare services, on patient outcomes, on the clinical practice, and so on. We also need to focus on interdisciplinary collaboration between CHS, EPIC, and HELI as well, so that we can create a kind of interdisciplinary AI program if we would like to focus more on AI at ECA, and then AI-focused students clubs and competitions. We could also do some discussions among students, led by students, and then some contests, competitions to promote AI-focused activities and help their peer learning for skills development. So as a conclusion, AI is transforming healthcare, transforming health management, transforming many of the fields of the clinical practice and provision of healthcare services. We are now witnessing more technology-based solutions like telemedicine and remote monitoring. However, AI will do more transformation of all of these areas, which needs really all of us to be up to date with all of these changes, like, for example, ChatGPT in writing, in text, and so on. And we have many, many other tools that can be used as well, not only in health education, but also in the healthcare practice itself and the provision of healthcare services. Thank you very much for your time. Now it's time for questions.
Thank you, Mohammed, for this interested talking about the health and the AI together. When some of your slides actually interact me to ask this question when you talk about the future jobs.
Yes.
As a doctor, as a direction of or in the doctors, and do you believe that the AI can replace the GP doctors in the coming future, like maybe another 50 years? As you know, the AI change a lot of things. From now we have ChatGPT, and we have a lot of tools. Do you think also change may be possible the reporting for radiologists? So when they look to the images and they make up films for MRI or any other scanner, and then there's a report comes at the end. Do you think the AI gonna be automated, generate kind of reports? Because the
Yes.
analyzing of these AI will be more accurate than the eyes, you know, and there is a lot of
Sure. Yes.
details can AI look to it.
Thank you very much, Uday, for these very good questions. Well, when I was doing my PhD at Macquarie University, a big team led by Professor Enrique Coyera, at that time, they were trying to invent a robot with the ability of being like providing services like diagnosing conditions, reading reports, and even like doing good voice recognition from patients. The problem was that the robot could not differentiate which one was speaking. Was it the doctor or was it the patient? Because it is trained on the voice of the doctor, but it's not trained on the voice of patients. So in my point of view, this might need like a few decades to have like a complete ability of replacing GPs, for example. But for the time being, let's say for the next 10 or 20 years, I think from my experience and from all the research that I have went through, I think it will improve the productivity of the GPs, so that a GP could do either more job, more work, or could do better work in terms of more accuracy of, let's say, parsing the text, natural language processing for the text, better voice recognition. It can help the doctors to write accurate reports easily. Much improvement in the voice recognition area. This is one thing. Much improvement for radiologists, for example, when they examine MRIs and CT scans. And I have seen the prototypes of these systems. They can really identify the lesions, the different like tumors and cysts and other things within brain, within the liver, within different organs of the body. But nowadays, we are witnessing a more clever systems that can even identify the exact type of the tumor. Not only that this is a tumor, but the exact type of the tumor.
Wow, that's amazing.
And it's accurate by 95%, which means that at least it will give you like a short list. You know, when we say like a short list in medicine, we call that a differential diagnosis. So instead of thinking of 40 conditions, it could tell you that this is one of two or one of three things. And then you have these tests to differentiate. So if you find this value, then this is the diagnosis. If you find that value, then this is the diagnosis. So this is another type of a clinical decision support that could really improve the productivity of the doctors and their accuracy of diagnosing and managing different conditions. The other thing related to reporting, yes, it can help the physicians to read the reports and to write the reports in a more accurate way. Now we have text to voice, voice to text. So we have these different things. So it can help the physicians to listen to the reports while doing like typing or examining the patient or something. So it will save some time. And in the same time, when they are writing their reports, it can help them to identify errors, not only in the grammar or the context of their writing, but even in their consistency. For example, certain diseases come to males or females, certain diseases come on certain age groups, like juvenile diabetes type 1 comes in children, for example, more between the age of 5 and 9 years, and then late onset type 1 is like 30s, and then type 2 is 50s. So it can help to manage the consistency of reporting in a more accurate way from a medical perspective, not only from an English grammar or language and so on. So this is another dimension of productivity and accuracy. So it will help in every aspect, but I don't think that it can replace really the physicians or the nurses, but it will improve their productivity much, which is very important aspect, because in Australia, we are 82,000 short nurses. So we need more, we need nurses, we need more 82,000 more nurses for the healthcare system in Australia because of many, many other factors, including aging population and so on. So if we improve the productivity of the existing nurses, we might be able to minimize the gap and reduce this kind of deficiency so that we can utilize the manpower, the workforce existing now for more productivity and better outcomes for patients.